Hi, my name is Mohammed, and today I'll be talking about the impact of information technology on patient engagement and health behavior change article. So overall, IT platforms have shown to improve health behavior amongst different disease categories. Studies showed that the use of internet-based tailored weight control programs was correlated with a significant increase in weight loss and walking distance. An important study showed that Twitter usage amongst cancer patients was a valuable medium for sharing information, discussing treatment, and also acted as a psychological support. This is important because people who are going through certain diseases like cancer can talk about it with other people going through the same issues, and that way they'll feel more hopeful in overcoming the struggle. Another study showed that mobile-based intervention study found that text messaging enhanced successful engagement of diabetic patients in their own healthcare.
So, as information technology continues to grow, there are clear trends between the increase in patient engagement as well as change in health behavior. Over the years, there continues to be more and more IT apps or social media related to health that stimulates more interactions related to understanding your health, weight loss, monitoring of health, etc. It allows for more empowerment to the average person, and it can create motivation for an individual to live a healthier life and be more cautious about their decisions. So, in my personal experience, I've used many apps in IT, such as my Apple Watch, the Nike Run Club app, and a weight monitoring app that connects by Bluetooth to a scale. These apps really encourage me to be motivated and be more health conscious, but sometimes the engagement would not last very long. As this IT health field continues to grow, there are many improvements that can be done. I think the integrations of certain IT apps, as well as the integration that would allow a physician to see this data, I think it would help the engagement and behavior change of an individual to be more long term.
Hello everyone, my name is Dennis and today I'll be talking about how wearable sensors can measure one's respiration levels. So in essence, these are very inexpensive and disposable sensors that will continuously measure one's breathing rate and volume. This is important because there's not a set way on how to measure one's respiration levels. So they're designed to help children with asthma, cystic fibrosis, and other chronic pulmonary conditions to eventually help predict if an oncoming asthma attack were to occur. Right? This is important because this technology can not only save lives, but it's revolutionary because nothing like this has ever been done before. I agree with what Michael Chu said in the article in regards to it's so practical. You put it on, you forget about it, you go about your day, and you're getting lifetime, data on how your body is currently doing. What's really nifty about this device, which I like about it, is that it's signaled through Bluetooth, so it connects to your phone and it will relay the information onto your phone, making it very accessible.
So during Monday's lecture, Professor Young talked a lot about how people are able to change their behavior due to individual aspects, whether it be motivation, self-interest, or discipline. However, since I'm coming from a public health perspective, I think in a socioeconomic frame, I think about the resources people have. For example, someone with a higher income or doesn't experience racial discrimination are probably more likely to be able to change or modify their behavior compared to someone who is less privileged. However, I think this is why it's important to consider factors such as class and race and the difference among groups of people, and how there isn't just one right solutions, and solutions need to fit the different needs of different people as well.
For this week's segment, I wanted to talk about the different aspects designers had to look into when they're making personal informatic devices, and basically what did they have to consider when they're making their apps. Now, our guest speaker brought up how effective can a device actually be if people don't actually want to use it. Now, it's just not enough to monitor something, but something that people actually have to care about. Now, I think these are all great ideas to discuss because I wouldn't want to take the time to use a device if it kept track of something I didn't care about. Now, the asthma detection device was interesting, and how it can monitor the change in someone's breathing pattern. Now, this is important because it can save countless lives and can help monitor problems before they actually occur and try to prevent it. But some shortcomings we should consider is what is the cost and who's able to see this information, and what privacy issues are there?